Hi, hope you're all well. I'm Viv and I'm the face behind Skinpharma Aesthetics in Stockton-on-Tees. This evening, myself and Sunny, we're continuing our weekly series of lives looking at the use of ultrasound in our facial aesthetics work. Hi Sunny. This evening, we are talking to another guest who will be joining us. I'll just add Sunny. There we go. A guest who's based over in Belfast in Northern Ireland, and she's a nurse aesthetics practitioner. And hi, Sunny.
Hello, Viv. How are you?
Fine, yes, doing well, thanks. So you're in the clinic there, are you?
Yeah, no, I didn't want to race home, so I thought I'd stay in the clinic and do it from here. But I thought I half got changed. Well, I got changed, and then I was like, actually, by the time I rush home and then log on and then look flustered, I thought I'd just wait here and keep you to the timings. That's fine. I think Lynette has joined, but she's not requested.
She hasn't. I will just send her a message. There she is. I'll just send her an invite. Yes, tonight we've got a nurse practitioner based in Belfast who's actually been watching our lives. Here she is.
Oh, where am I?
Yeah, that's the back of your camera there.
Yeah, just
switch it around.
Yeah, there should be a little switch to reverse the camera, Lynette.
Oh, no, I'm the other way.
Well, no, don't worry, Lynette. No one's noticed. Viv and I will carry on talking.
No. It's
so.
Can someone tell me how to turn it around? Sonny, how do you turn this? Is there a button somewhere?
Yeah,
so, that's true. It's doing off the rear camera, isn't it? You might have to physically turn.
Okay.
There. So on your image on Instagram, there's a little there's two arrows that go round and round.
Yeah.
I'm here.
If you press yes.
There we go. There we go.
Hello.
Hello.
That's
that's a dramatic entrance, isn't it?
It was, I know. It wouldn't be like me. I've always got a dramatic entrance somewhere, Sonny. But thank you both for having me on today. Honestly, I'm so privileged. I'm honoured.
Oh.
Yeah, I've been watching you for so long, and I'm like, yeah. So if I'm a bit nervous, this is my first live on Instagram.
But you, Lynette, you do lots of social media. Though you do a lot of reels and lip syncing. Nervous for this one then?
Yeah, just because it's you two. Just because it's you, Sonny, okay. And Viv. You know, when I'm on my own, I'm okay.
We're the same as anybody, Lynette. We're just two practitioners who like talking about our work. So it was really nice to be able to sort out a meeting with you this evening. So we've got to thank you for doing that.
Thank you.
You've been following us. You've been following us for the last 6 odd months. I think we started in April, and we did our weekly sets of lives looking at our own journeys into the world of aesthetics and ultrasound in particular. And I think you were one of the first to follow us regularly, so we've got to thank you for that.
You're welcome. I've loved every minute of it. I've become obsessed with ultrasound, and can't wait to get my machine, hopefully in January, all being well. Yeah, so for me, I had not heard of ultrasound in aesthetics. I have not seen anybody using it, or that's what attracted me to you and Sunny, was that you had spoke about this. A lot of the other practitioners at the time were a bit hesitant on it, you know. It's not great, it won't find a vascular occlusion. But then as I looked deeper and deeper into it, I thought, no, this is going to change things. Yeah, I believe it is. Yeah.
Well, what I'll do, I'll let Sunny start off. He'll introduce you and you can talk a little bit about your background, and I'll jump in from time to time and ask you little questions about what you do and how you think about ultrasound. So I'll let Sunny take over if that's all right.
Hi, Sunny.
Hi, Lynette. Hi. That's the first time when you've done that, but the speaker hasn't then gone straight into just introducing themselves. So when we've done it in the past, you say that, and then they go and start introducing themselves, and then I sort of say, Oh, but then it's fine. It's fine. It's just Lynette got it. Lynette's in it because she's understood because she's watched it so many times. Lynette, we always ask this for anyone coming on to the lives, the show, that you know, where did your sort of career begin, and then what was the turning point into aesthetics? So I think everyone watching will be really interested to know about you as a person.
Well, I was a bit of a late starter into nursing. I had no education until I was 38 years old. I grew up in Belfast in the time of the Troubles, and I come from a working class family, didn't have much money, and my mum was more worried about putting food on the table than really education at that time. So it was like you turn 16, you go out to work, and that's that. So that was up until I was 38. So I got pregnant at 21. I come home to my mother and father from Puerto Rico.
Okay.
Yeah. Well, as bad as this sounds, to a good Irish family. I come home from Puerto Rico and I was 7 months pregnant, to my family. So I was a single parent. I raised my daughter alone, working as a care assistant. I worked 12-hour shifts, night and day, and was in that game for 20 years of a care assistant. My number one aim was to educate my daughter. So for me, I had in those days, well, then I thought I have got no money to give, so what better to give is to give her a mind to make her own money. So for me, that was a real turning point. So my daughter done amazingly at A levels, went to a grammar school, and then went on to do her degree in Liverpool. And I decided to myself that that was my turn. So I started with maths and English, GCSEs. I done a science GCSE, and then I went into biomedical sciences, which I absolutely loved. But unfortunately, within the realm within Northern Ireland and at my age, it was a sort of a pathway that I may not have got far in right now. And I also had a passion for nursing, so it was between those two, and I chose the nursing. I done my 3-year degree, which I absolutely loved. Yeah, I loved being a student. Yeah, I was away every day with my school bag. Even when I was 38. Or no, I was 40, sorry, at this stage. I was 40. So I was off to school, off to university, loved Freshers Week because I'd never experienced any of this. Even this 40-year-old woman was literally, you know, I felt 16 again, you know, all that kind of way. So then after I finished my nursing, I was in a pandemic at the time. My mother had taken sick. And I had to come out of work to look after her. So that was then where I become really interested in aesthetics, even though I had always told people years ago I was going to own my own aesthetics business. No one believed me. Yeah. No one. So everyone that knows me and who I've worked with over the last 10 years, I always says one day I'm going to be an aesthetics practitioner. So it was always that drive in me to do so. So I started over lockdown doing modules, then come out, then done training, and was really training for a year before I actually come out on to do aesthetics because I was a bit frightened, a bit unconfident within myself, and really didn't believe that I was capable. So then this brings me to the next part. Sorry, how long have you got?
No, it's good. It's good. This is exactly. I mean, this is exactly what we want to hear because one, it's amazing. You know, as a single mum, bringing up your daughter. She's gone on to do things. You then, you know, I can't believe how old you are because you look so young. And then
he's a right talker, isn't he, Lynette? He's a right talker, isn't he?
You make me blush, Viv. So no, this is exactly what we want to hear because we're just real people. We all go through struggles. Everyone just assumes, you know, we've got a nurse, we've got a doctor, we've got a pharmacist. We all get labelled as a stereotype, but actually, there's a lot more to our stories. So. No, go. So the turning point. Then the turning point came, and the fact is, you did this all in pandemic as well.
Yeah.
It's so new. It's so fresh. So yeah, go
Yeah.
for it. Go for it. Sorry.
So for then after that, I had come out and I met a man. Well, not a met a man. I met a Dr. Sharad Chaman online, and he was doing positive intelligent coaching. And
Yeah.
I decided to myself, wow, that really blows my mind, making the brain like a muscle, working on that brain. So I was quite excited, and I wrote him I sent an email. He's in America, he has wrote books, he's been in the New York Times, not believing that this man would actually answer me back, and he did. So I done his course for 24 weeks, free of charge. He did not charge me at all. And I ended up then becoming a positive intelligence coach for women, which
Wow.
a lot of people before I went into aesthetics. So that's what I done during lockdown. I helped other women build their brain and belief that anything is possible. Some of those women have gone on now to university. Some
Wow.
of those women have got businesses online selling products. And these women come to me and they literally were in the pits of either anxiety, depression. And yeah, so for me, and I still sort of I do that on the side today, is I'm still a positive intelligent coach for anyone that needs me. I didn't realize how benefit it would be within my clinic.
Oh, really?
And to watch people grow, women grow, especially women, over like say 4 months of coming in and getting treatments, it is beautiful to watch, because not only am I working on the inside, but I'm also working on the outside, and it just makes the inside go faster.
I mean, the universe has a funny way of attracting like-minded people together, because that's exactly, I mean, Viv would agree. I'm sure that it's that holistic approach, isn't it? Which,
Yeah.
just bringing you onto the show now, God, calling it a show now, but bringing us to the live now, the fact that you're doing that, I don't think I've ever picked that up from any of your social media. How come you don't,
No,
how come you don't advertise that then? Not to get paying clients or anything, but just the fact that you do it.
I didn't know whether the two fitted. At the start, I was sort of like all over the place. I didn't know. I was finding my feet. I didn't know whether the two fitted together. I was known online within the Facebook community because I had a private group. It was a private paid membership monthly. So I wanted to sort of like split the two at the beginning. But now I've been practicing for nearly a year. I've noticed that this is needed within this industry as well, because I do have an older women clientele. I understand I do have a lot of lips for young, but my women would be 50 plus. Yeah, always, and most of the time have a story to tell to come, and
You've got some great reviews on your social media, which is a testament to the work that you're doing. So the coaching side, definitely, we really in awe of that and respect. But just go back to your aesthetics then. So how did that sort of then develop alongside it?
so the aesthetic started was I just started practicing. I got involved with some companies, and just literally started practicing. I just decided one day that I needed a premises to do this. Everyone thought I was nuts because obviously I wasn't well off. I didn't get any loan. I didn't get nothing. I had £2,400 in my bank account, and I decided that I would go and view a room. This is another thing of what you're saying, Sunny, how you attract certain people. So I went to a chemist, which was a room above a chemist, and the guy says I couldn't open the room after 5 o'clock because he closed the chemist.
Yeah,
I says, well, that's not really going to suit me because I need late night working, anytime I'm there. So there was a girl standing in the shop and she asked me what I wanted it for and if she could help. She was a customer in the chemist. I says, oh, I'm just started aesthetics, I'm a nurse and blah, blah, blah. She says, my father has properties. Do you want to come around and have a look? So that's literally what happened. I went round, had a look, and he says to me, you don't have to pay any deposit. I will put a sink in the room, decorate it as you want it, and it's yours. And literally, that's what started my business last year on the 25th of October, was my first day.
Amazing,
Yeah.
amazing. And, your work speaks for itself. Viv, go on, over to you for some
I'm
questions.
just amazed at your story, Lynette. You've just done so much. You're an inspiration for everybody here, not just patients, but members of the aesthetic community. You know, a lot of practitioners could learn a lot from your work and what you've done, because you've done an amazing amount of different things, and you've started from nothing. And look what you've done in a year. You've done amazingly well.
I know. Sometimes I think it's a dream. I can't actually believe I'm sitting here, really. There's a times I'm like, yeah, really? Is it me? Yeah, it's me.
You've done amazing. But what we were wanting to talk to you about really was about how you moved from your aesthetics work. You've got your own clinic, and it's going to be a year old in a few weeks' time, so you've done amazingly well. How did your work progress, and you started doing lots of different treatments? You do whole loads of different aesthetic treatments. That progressed over the last year or so, would you say, that the treatments that you provide?
Yeah, the confidence has progressed. You know, obviously, I was really dubious about, you know, anyone coming. I was bringing people back every week. I was a stalker to my patients because I was afraid in case they had a VO and they didn't know. So I was literally like a stalking aesthetics woman. Everyone I injected, I was there 2 weeks later. Hello, is everything okay? You know, it's a wonder I kept the customers. But yeah, so for me, it was like, yeah, it was really nerve-wracking. As the years gone by, I feel more confident. I have had a VO, which was quite frightening, but I had the training and I knew exactly how to deal with it. So for me, that was...
You've got a question, actually, just from Kahlo Aesthetics Limited. They've got, because they're obviously setting up their own premises now, I think, and they just said, how did you attract clients, and what was the transition like for you from the NHS to aesthetics?
Well, that transition didn't take place straight away. I was still within the independent sector. Yeah. I worked in, my background is with dementia. So I worked with 20 years within dementia. I was pretty known in that field also, and within the Royal College of Nursing. There was things I had set up and made packages, which was to walk in your shoes with dementia. And that was done from me and my workplace. That's now in with students in Queen University, which gives you a feeling of what it feels like to have dementia. So the noise, you have headphones on, glasses on, feelings of your feet and your hands, and how that feels to be so vulnerable. But that's teaching care assistants and other nurses of how to act around someone with dementia, you know, and I think that lacks a big thing as well, you know, in hospitals, is dealing with dementia patients, yeah. So I sort of at that time had gone on a pathway to try and, yeah, let the world know what dementia really was all about. So I went to, and what I've gone off of my trail, Viv.
No. So I think they were just asking very quickly. I mean, we can cover it again at another point. But I mean,
so how did
you attract clients when you set up your new premises?
To be honest, literally, yeah, just a lot from word of mouth. Obviously, it doesn't come straight away. I'm still not, you know, straight away at the moment. I'm making a wage and I'm making a good living than what I've ever had, but on the other side of things, it is just building up over the year. So it's client coming back, you know, so every new client you're getting, the other people, you know, so I can see it growing you know, so I started off with maybe 42 clients in the first 4 months, which isn't a lot of clients. Now I have actually done 392 clients. Oh, so wow. That is growing over time. And I hope it grows this year as well.
I think before we do run out of time, Viv, you were going to ask about going into ultrasound again, because we digressed.
Yeah. It's amazing listening to you, Lynette. It really is. You could carry on all for the rest of the next couple of hours without any problem. But in terms of the aesthetics, as you progressed, and you found myself and Sunny doing an Instagram live some months back. What was it that attracted you to the idea of ultrasound in aesthetics? You said you hadn't really come across it before, but you became attracted to it perhaps as a result of us starting our lives. Is that right?
Yeah, 100%, Viv. That's what it was. So for me, I think if I had it within my clinic, it would build more confidence, obviously, in myself. I would know exactly where I am putting that filler for safety for the patient. But I have a lot of patients coming in with past filler, and I don't know where that filler is, you know. And sometimes that can, from having a face with no filler in it to a face with a full, maybe someone's at one stage has gone and got 7 mil, 9 mil. Sometimes it's really, really hard to aesthetically look at that face and build those planes. And I think with the ultrasound, it would not only be safety for the patient, but also give the patient a better result and me more confidence in my injecting.
One of the things you mentioned a while back was that you do non-surgical rhinoplasty, but you haven't done it from the time you first trained because you were just worried about it. Is that right?
Yeah, 100%. I have. So I'm trained in that now nearly a year, and I have only done 2. So I've only done 2 rhinoplasties, and the reason being is because I'm frightened. It's such a vascular area. We're going in blind, and I just think it's not worth the risk. Really,
Yeah.
you know, if it's you know, it's just, for me, it's frightening, and I know people will say, "Oh, do 1, and you'll get used to it and do it." But for that area, I don't do temple filler either, for the same reason, is because I don't do that. It is, yeah, I just think it's safe. It will be safer to have an ultrasound, and yeah. And I think once I get my hands on one and I learn to read it, well, I've done all this education, so I'm bound to get the ultrasound. I'm determined.
I was just wondering, in the local area where you're based in Belfast, Lynette, how is ultrasound? Is there much prevalence of ultrasound in the local area? Is there many practitioners that use it?
There is one practitioner that has an ultrasound, but doesn't really speak much about it. But no, I think she's the only one in Northern Ireland to have it. Yeah.
Right. Okay. And with ultrasound, do you think patients may be attracted to you because you would use ultrasound in future? Do you think that would have some attraction with members of the public coming to you?
Yeah, definitely for me. I mean, I do get aesthetics, as you can see. I'm not looking this fresh for nothing. But the thing of the matter is that it is, you know, for me, for yourselves, for example, if Sunny had an ultrasound, now I would go to someone like Sunny because he has an ultrasound. He's going to scan my face. He's going to see what filler is in there already. And yeah, it's just safer, and I believe it will be a more better result.
Yeah, yeah. In terms of finding out more about ultrasound, about whether it's suitable for you, whether you'd be happy using it, what would you like to see in terms of education and support for people like you who are just considering the idea of using ultrasound? What would you like to see? What would help you decide and make things easy for you? What would you like to see?
Well, definitely courses becoming more available, you know, for reading the ultrasound. Obviously, yes, you can practice, but a course would be ideal, you know. So once you get your ultrasound, a course to come alongside that would be amazing. And then it's sort of what I would like to do, hopefully, this is my next adventure. I would love to learn ultrasound and then be a trainer in it in Northern Ireland.
Yeah, yeah. It's just that we've used ultrasound since the beginning of the year, pretty much, myself and Sunny. We've been talking about our own journeys involving the scanner, and we've spoken to lots and lots of different specialists from around the world, as you've seen over the last 6 months.
Yeah. It was like Stephen with the highlight story. It was, he had said the woman had put 500 units or 5,000 units of highlights into the occlusion. Yeah. But when the ultrasound was present, he put the ultrasound and he used to unblock it 0.25 for the occlusion. For me, that was like, wow, you know exactly where it is. You're going in, you're using less highlights, which is more beneficial to the patient and anyone with heart problems and so on. But yeah, so yeah, I think it just amazes me, and I know I will have it.
What about something like shadowing? Would you like to see something like the availability of being able to shadow a practitioner who uses ultrasound in their normal day-to-day practice? Would that help you?
100%, yeah, because then you would see how that person's using it. You would see, hopefully, they would be also teaching you the different planes from in the ultrasound, like yourself. And I like the way you put the colour on. That is so, it just makes me understand it more with colour. That little bit of colour makes all that difference within those planes. And I just think something like that, a book or training along those lines, just to help someone like myself maybe progress within that area.
Yeah, yeah. Anything you wanted to say, Sunny?
No, I was just listening to that. I'm just thinking and reflecting on Lynette's career so far, and obviously just in that short space of time. Do you think that doing was it Dr. Shirad? Is that
Yeah, Dr. Shirad, yeah.
Do you think doing, I'm guessing it's kind of mindset training,
Mm-hmm.
do you think doing that actually accelerated you even more than what you would have without it?
Yeah, 100%. So it's like when we're working out our bicep and we're building that muscle. I spent 24 weeks building the subconscious part of my brain so instead of my brain controlling me, I started to control it. I had obviously my life beforehand was completely different from now. And yeah, so I had a lot of sabotage in there, scooting around. I wasn't worthy. I wasn't, I was unconfident. I always kept myself small because I thought that's what I had nothing to offer or give the world. But when education also set in, I was like, wow, I can do this, because for so long I was always told you're stupid or you'll never do that, or, so for me with Dr. Sharad was just, he changed my world actually. He did, he changed my world. Yeah. And on that process of 24 weeks, it's intense. You can imagine 24 weeks of building that bicep, yeah, it was intense, but you come out the other side a brighter, positive, and yeah, I always just keep showing up, no matter what's happening in my life. I just believe, just show up and see what happens.
Good. I think a couple of questions before we do conclude, because I think 30 minutes is a nice one to watch back as well, and Lynette, you can testify to that. What would you advise other practitioners to think about or ask before they go down, going down an ultrasound route? What sort of things should they be asking? Maybe about their practice, maybe about what they're doing.
Well, how beneficial would be, how many clients are you going to use it on? And find out about training also, which there is none in this country at the moment, of training. And literally, just see how it's benefited them. I've spoke to some people about ultrasound, other aesthetic practitioners, and it's not of interest to them. Which is everyone's own view and opinion. But I do believe on down the line, within the next, say, 3 to 5 years, I would say most clinics will have an ultrasound.
Exactly.
Yeah, and I think it may even come into insurance at one point.
Yeah. Definitely very insightful. Viv, go on, I'll let you have the last word.
Just a total inspiration, Lynette. You've been a total inspiration to everyone, I think, who's been watching this evening. I've just got to say how interesting it's been, listening to your whole life story. It's just amazing what you've done over the last few years. But I just think you're a really nice person. It's really nice to be able to speak to somebody like you. And I think if support can be provided in Northern Ireland, and there's enough demand for training and support for practitioners like yourself, I'm sure it will be made available. Perhaps we could speak to the ultrasound providers and look at how they could possibly help support people like you in Northern Ireland. We might speak to Rachel and Ben at Bell and see what they could do maybe to help you in some way. It'd be nice to help each other. Yeah, we'll try that.
That would be amazing, yeah.
In terms of social media, because we've been talking as a result of Instagram, I just wondered, how much has social media helped you communicate with other practitioners around the world? Has it made a big difference to your work?
Yeah, 100%. Yeah. But not only that, it brings me a lot of customers, brings me a lot of new clients. I ask, is it my work you've come for? Is it, why have you come to Kahlo today? And it was like, well, yeah, it's just your vibe. You seem down to earth, or, like your vibe. Or when people come to the clinic, it's quite or not airy-fairy, but I love certain things like crystals and smells. And so when you walk into the clinic, I want you to enlighten your senses almost. Yeah, so whether that be through smell, touch of how it feels. Yeah, and I just think being, you know, because I remember I was so nervous to go to like a makeup counter. I was afraid. I was like, oh God, no, it's only posh people go to the makeup counter to get their makeup done. So you never really treated yourself to anything. But now, oh, I go to the makeup counter, I get my hair done, I get my nails done once a month. So yeah, I'm just looking after me, just doing me.
Investing in yourself. Yeah.
You look.
Yeah.
You sound like you're enjoying yourself, and
Oh, I am.
you deserve it. I think you deserve everything that you've got, Lynette. It's really nice talking to you. Is there anything else you'd like to say to anyone who's been watching, based on the fact that they may be considering ultrasound? They're in a position like you, having worked in as a nurse or as another healthcare practitioner. What advice would you give them? What would you say to them if they're thinking just like you've been thinking?
I think obviously you may think to yourself that you're not going to be able to read it. So what is the point of getting it? As a nurse, I come from surgical background. So in ultrasound surgical, the doctor looks at it, and I have no clue what's happening there on that scan, you know, and they know it all. So for me, it was it was frightening to think, no, I won't be able to read it. But as I say, if you want something and you believe it will be benefit to your life and others, then yeah, you're going to learn how to read it. You're going to teach, whether that be teach yourself or through training. Yeah, in reality, we can do anything, you know. So I know that will put a few people off, but for me, no, because I know eventually, whether it takes me 6 months, a year, I am going to read that ultrasound.
It's fantastic to hear somebody who's so determined as yourself. You're not willing to let anything get you down, and you've always got something to push you further and further. You're never going to give up, are you, with life?
No,
at all,
no, definitely not. No, I'm going to keep on. Yeah, keep on going. I have a few other adventures on the go at the moment, which hopefully I'll be coming out soon. So yeah, I've got a few things lined up. I'm going to collaborate with someone else, and I will be the nurse led in their clinic. So yeah, I'm going into training. So yeah, there's all different. Yeah, so many possibilities.
Brilliant.
It'd be great to meet up with you sometime, you know, because it's just this chat alone's really inspired me, I think, with all the work you've done. So I think we both love to meet you, won't we, Sunny?
Definitely. I mean, it's been a while since I went to Northern Ireland. I think the last time I was there was on, was at Ballykinley with 2 rifles after I'd come back from the tournament. So, yeah, no, Belfast.
You haven't seen. Yeah. Something you haven't seen the nice side.
No, exactly.
We'll sort out coming over to see you some point, Lynette. But again, you're always welcome to come over and see us, see the work we do over in the UK, in England. So
I would love to, Viv. Yeah, and one day I'm going to make it. Yes, definitely, I will make that happen. Yeah, I shall see you in action with your ultrasound.
You will. But we just wanted to really thank you. Really kind of you to join us, and really nice of you to follow us over all of this period of time when we're doing our lives each week. So thanks very much for that.
I'll still be here. I'll still be watching.
Thank you. We appreciate it.
Thank you so much. Thank you both for having me on. Honestly, I'm so grateful. I've loved chatting to you both, and really can't wait to meet you both in person.
Brilliant.
You're very kind, Lynette. You're very kind. We just wanted to say next week we've got a sonographer who we should have had a couple of weeks back. Technical difficulties stopped that progressing. I
look forward to that. Actually, her story only began, and it was really amazing. And I was like, oh no, it's ended. But no, I will be watching tomorrow night or next week.
It'll be next Thursday at 8:30 on the 13th of October, and it's Candice Deary from Portland in Oregon, and she's a sonographer in the US. So we'll hopefully not have any technical problems with her next time. So we hope to see you then. But thanks very much for joining us, Lynette.
And I'll speak to you all soon. Bye.
Thanks a lot.